Seen a rise in diabetic ketoacidosis over the course of the pandemic, which could possibly be correlated with weight gain and inactivity for some over that time. Regardless, it's a serious issue that can be avoided. Here to join us and tell us more about the topic is Nurse Christina Paris from the VA. So good morning, Christina.
Hi, good morning.
Thanks for joining us this morning. And first off, what is diabetic ketoacidosis, and can anyone experience this, or is it only people who have diabetes?
So it is typically people who have diabetes. It's very rare in people who are non-diabetic, because usually what happens is our body uses sugar for energy, and we need insulin in our body it works as the key to unlock the cells to allow sugar to go in to be used as energy. So when we don't have enough insulin in our body, then our body turns to fat, and it breaks down fat for energy, which is good short-term, but long-term bouts, it can cause a lot of really bad things. It causes acid buildup in our body because we don't process that kind of sugar or energy the same way. So that's bad, and that causes the ketones to build up in our bloodstream. Now, ketoacidosis shouldn't be confused with ketosis. Ketosis is what we hear about with people who are on those keto diets. That's totally different.
Got it. Okay, perfect. And so what causes diabetic ketoacidosis, and how can it be prevented?
So it's caused by not treating diabetes properly. So maybe you're not taking your insulin. Maybe your insulin pump isn't working properly. Some people who are taking certain medications and taking possibly illegal drugs can cause it. If you are again not taking insulin as directed, those are usually reasons for it. So you want to make sure you're checking your blood sugars regularly.
Perfect. And if someone is diabetic and may be concerned, what can you tell us about the signs and symptoms we should be watching out for?
So you're not going to feel really well. You're going to be super, super thirsty, drinking a lot, and going to the bathroom. You're going to urinate a lot at night, all day. We have patients that are like, I'm just going all the time. You might have some belly pain, some nausea. You'll feel kind of tired. You might have some weight loss, high blood sugar levels. So be monitoring those blood sugar levels. You might be confused, all of a sudden just not know where you're at. You might have a flushed face, rapid breathing, dry mouth, dry skin. So if you experience any of those things, you want to get it checked out.
Great. And then what are some treatment options for those who are dealing with this?
So this is a medical emergency. So if you notice that your blood sugars are super high, they're staying super high, you're having all of these symptoms, you want to go and talk to your doctor. So first call your endocrinologist or your primary care provider. You might need to go into the ER and actually get fluids or electrolytes to rebalance that. And you're going to probably need insulin in large amounts, probably even an insulin through an IV to be monitored closely inpatient. So you want to call your doctor.
Well, thank you. That's so much great information. And of course, as always, we really appreciate you joining us this morning. We'll talk to you again next week.
Absolutely. You all have a great day.
Thank you. You too.